The COVID-19 pandemic is unraveling decades of health education and other advances for children across South Asia, and governments must take urgent action to prevent millions of families from slipping back into poverty, UNICEF said in a new report released today. With the pandemic expanding rapidly across a region contains a quarter of the world's population lives, Upended describes the disastrous immediate and long-term consequences that the virus and the measures to curb it has had on 600 million children and the services they depend on. The side effects of the pandemic across South Asia, including the lockdown and other measures, have been damaging for children in numerous of ways, said Jean Gough, UNICEF Regional Director of South Asia. But the longer-term impact of the economic crisis on the children will be on a different scale entirely. Without urgent action now, COVID-19 could destroy the hopes of the futures of an entire generation. According to the report, immunization, nutrition, and other vital health services have been severely disrupted, potentially threatening the lives of up to 459,000 children and mothers over the next 6 months. Food insecurity is growing. A UNICEF survey in Sri Lanka showed that 30% of families have reduced their food consumption. In Bangladesh, some of the poorest families are unable to afford 3 meals a day. In order to mitigate the impact on poorer families, the report says that governments should immediately direct more resources towards social protection schemes, including emergency universal child benefits and school feeding programs.